The field of hip and knee replacement surgery is evolving at the speed of light right now. There's advances, it seems like every month, and one of the things that I've learned to appreciate about my own field is technology and what it brings to the table. And one of the exciting things that I've incorporated into my own practice is robotic assisted technology, specifically for knee surgery. I have become one of the highest volume robot-assisted surgeons on the East Coast and become a teaching surgeon. Every surgeon wants precision instruments, precision tools. That's what robotic-assisted surgery brings to the table. It gives you the most precise and accurate of tools to make your results better. As I've evolved my technique with the robot, patients really do recover their range of motion and recover their ability to walk and function more quickly with the use of this technology. When the pain in your knee or your hip is an obstacle to those simple things you enjoy in life, well, that's when surgery is really necessary. And it's meant to restore your life and to get you back doing the things you enjoy. I'm very excited to be joining Dr. Johnson, and with my fellowship in hip and knee replacement surgery, I'm hoping to follow in his footsteps and hopefully expand upon the already amazing practice he's built here. And of course, I want to restore people to be able to do those lifestyle things that I want to do, like playing pickleball, playing golf, and that's where being a hip and knee surgeon comes in, and hopefully I can offer that to people of this community.